Trackehr.
There's an F in here.
All right, hello everyone. My name is Kjartan and I'm a doctor. So I once had a patient. She was a middle-aged woman from a small town in the west of Iceland who just had a knee replacement surgery. I met her a day after the operation. I told her it went well, but she lost some blood. So we had to give her some fluids, blood units, and monitor her over the next days. I also explained her pain medication, x-rays, and rehabilitation process. Now, most likely, she would not remember my explanations and would be unable to explain to her closest family. According to research, 40% of patients don't know the reason why they're admitted to a hospital. 58% of patients don't know their diagnosis on discharge. And 68% of patients don't even know the name of the doctors attending them. So according to these numbers, she probably didn't even remember my name. But this is exactly the problem we're solving with our product. So we live in the 21st century where people are used to having all their information in their smartphones. So why should it be different when we're at the hospital and our health is at stake? There are already communication platforms to communicate with patients at home. But we saw the growing need for a secure communication platform within hospitals. So people would still see their doctors, but additionally, healthcare staff can share real-time information to the patient's smartphone about their condition and treatment plan. Patients can then even choose to share that information with their family and even give feedback. But Trackehr is not only a platform to share information, because we also translate the medical jargon so people can actually understand. Now, the smartphone app will be free of charge to patients and will be sold as a subscription service to hospitals. But why should hospitals want to buy this service? Well, research has also shown that having patients involved in their treatment can shorten hospital stay by 13%. Now, applying these numbers only to the surgical wards at Landspítali would save 500 million Icelandic krónur annually. But more importantly, we improve patient safety and satisfaction, which then again gives a huge competitive value to hospitals. We're a team of 2 doctors and a computer scientist with extensive healthcare domain knowledge and programming expertise, and we've already delivered IT solutions now being used by Icelandic healthcare staff. In 3 days, we will start our intern year, where we will work in multiple sectors within the Icelandic healthcare system. We're already in talks with several healthcare providers that have shown interest in partnership. And during our intern year, this gives us a unique opportunity to both release and develop our MVP in direct contact with both our patients and our partners. We'll fund our project with grants for the next year, and then we seek to get pre-seed funding by the end of 2020. Now, the global medical market is a hugely competitive $7 trillion market where we saw an opportunity. So our first target market will be the medical travel industry, where patients travel abroad to get medical treatment. This is an $87 billion market with an estimated annual growth of 25% for the next decade, and where service has become the most significant factor when patients are deciding where to go. Now, with our extensive product development and our team, we're going to become leaders in providing a high-quality communication platform solutions in this both service-driven and fast-growing market. Now, from our work within the hospital and from the interviews we've had with our patients, we know that everyone wants to change hospital communication. And Trackehr is the solution. Thank you very much.
2 questions, guys, if you can. Thank you. Oh, another caller friend.
Yeah.
Friend.
Go.
Okay. I just have a super quick question. Thank you so much. How easy is it for the doctors to add that information? Do they do it on the go, or do they do it after? Like, how does it work from the doctor's perspective?
Okay, so
you use whispers.
Can you hear me? So we want to make our program as user-friendly as possible, because we know from our work experience that if you create a platform that is time-consuming for healthcare staff, they're not going to use it. So what we want to do is we want to automate some of the processes needed to deliver the information from the electronic health records and to the patients. So we would have to do this by integrating into electronic health records, and both using like familiar interfaces for doctors that they can use on the go at the hospital, and also using some automation processes to deliver the information.
Yeah, so we're talking about things like drag and drop. So you could basically go over the text, you could copy it, you could send it straight away to the patient's app. You could use snipping features to provide them with their x-rays. There are many features possible, but those are one of the first ones.
Isn't that directly what Whispers does, to ease that pain first?
No, actually, if we would have a hospital that uses Whispers, first of all, we would have 300,000 hours more that healthcare staff can work with their patients.
Well, competition here.
No, we've been working along with Whispers, and we can use that to they build the text, we share the text.
Yeah, and additionally, if you're using electronic health records with coded information that the Whispers can provide, it's much easier to share information that's translated from medical jargon and to sort of normal terms that people can understand.
Cool. Final question, are you guys happy?
So you're working directly with the medical records. What kind of regulations are there around dealing with the patient records, and how are you going to address this?
So there are several things that we have to have in mind. First of all, it's a GDPR that was set on stage last year. Then it's the Icelandic Directorate of Health. We have to work it in close coordination with them. And then the laws that we have here in Iceland. We have to merge all these things together and create a secure platform, because that's one of our main funds of having this work. And then, of course, when we scale outside of Iceland, we have to work it in every field in each country. So.
Cool. Also adding to that, there are actually examples of Icelandic health tech startups that are working with delicate information, including electronic health records. So we don't see that as a major barrier for us.
Awesome. But just before we leave, we're going to do something rogue. We have a question from the audience. Oh. Can you shout it out?
Yes, I can. Lumina Medical Solutions, do you know that?
Yeah.
What's the big difference between what you guys are doing and Whispers and what they are doing? Because that's also an Icelandic startup company which is doing a good job. So I'm wondering if this is a...
Do you work for them?
No. I'm just wondering what's the big difference?
So Lumina is creating an interface to make it easier to document electronic health records, which is basically what Whispers is also doing. So I think they are kind of in a more direct competition.
Yeah, basically all the information that Lumina would create, it's an electronic health record software. Well, that's basically the softwares that we are plugging into. So those are the softwares that create the text, that create all the content, and we are a portal towards the patient. So, if there are more EHR companies, on the market, we just salute that, and we are ready to work with them. So,
thank you very much, Trackehr, with an R. Thanks, man. Good job.